here right now. Congressman, good to have you. You worried about this?
Hi. Hello. Hi, Neil. Good
to have you, sir. I don't know if you heard me there, but these Blue Dog Democrats think they have the votes, do they?
Well, when you say they think they have the votes, the Blue Dog Democrats, as you know, I work very closely with them, they're all for health care reform, as was John McCain and Barack Obama and Hillary Clinton and others during the course of last year's campaign. The issues they have, of course, are specific as to the ways of doing that, and they're discussing that. They may well have the votes for some changes in the bill. I'm not sure. The bill's going to be marked up over the next 4 or 5 days, and we'll see. But certainly I know the Blue Dogs want to vote for health reform. They think health reform is necessary, and they think it's necessary to make sure that every American has access to affordable quality health care.
Yeah, but not all of them. I guess not all of them.
And that we bring costs down.
Gotcha. But not all of them were probably eased today to hear the speaker say that tax hikes meant for health care might be repurposed into deficit reduction. I'm sure that confused them. But did it confuse you?
Well, I didn't hear the speaker say that, but the bottom line is we're going to have to bring costs down. That's got to be the objective of this bill. Cost for the government, cost for individuals, cost for families, cost for business. We're going to have to bring costs down of health care.
Right.
As the president said, our present costs are unsustainable over the long run. So that's got to be our top objective.
I know you've been rushed and busy today, so you can't catch all of this stuff. But this is what the speaker said today, Congressman, and it confused some folks. Maybe you can help me with this.
We have a revenue stream to ensure that the bill will be paid for. If we don't need that money, we can use it to reduce the deficit.
It confused me this way, sir, that if that money was supposed to be to pay for health care, and then it turns out you've got a lot of savings, more than you realized, and you don't need that money, then why not just give that tax hike money back to the people you're hiking it on, rather than repurpose it for something else?
Well, Neil, I think we have an extraordinary deficit challenge in front of us, which has been added to in the last few months, as you know, in trying to meet the economic crisis that confronts us, at the request, frankly, first of the Bush administration and then the Obama administration. So I'm sure what the speaker was saying is, look, if the revenues that are projected to pay for in the short term the inclusion of all Americans in the healthcare system raises more money than is projected, and that there is money available, rather than put that to other spending, what we ought to do is reduce the deficit. We have to reduce the deficit. We have to reduce it for this generation and for generations to come. So I support her in that effort. I think that's correct.
But you see what I'm saying, though, Congressman?
As a matter of fact,
I know what you're saying, sir. But you see where, if you're, let's say, a really rich dude, right? Let's say you're Bill O'Reilly listening to this, right? And all of a sudden now you were told that the 5.4% surtax you were going to have slapped on you to pay for health care was going to be for health care. And you already knew your top rate was going to go up, ostensibly to even things out, you guys say, from the Bush years. Then all of a sudden, that 5.4% hike is for quite another reason, right?
Well, I think you're correct on that. Again, I don't know what the speaker's context was, whether she was simply saying in response to a question, what if it raises more money and you have more money in the Treasury? Then she was saying, well, we'll apply that to deficit reduction, which I think would be appropriate. It's another thing, you're correct to say that if, in fact, we conclude that the rate is not necessary to pay for what we have said we're going to pay for, that is health care reform, then we ought to modify that percentage. I agree with that. I'd have to look clearly at the context in which it was said, and also look again at the estimate of what our costs are going to be and what our revenues will be.
But let me ask you, do you feel you're losing control of this, that it's slipping away from you?
No, I don't. As I said, every member of the Democratic caucus believes we need to have health care reform. John McCain campaigned on the basis that we needed health care reform.
Well, he's not for this. We just had him on. I tell you, we just had him on. And he's not a happy camper with this. He says the spending is way out of whack, and it's not what he envisioned. And this is the polar opposite of what he wanted to see.
John McCain doesn't agree with the means to achieve the objective he said was an important objective. And when he was running for president, campaigned on, that we needed health care reform. He had a different proposal, and very frankly, I'm sympathetic to one of the funding proposals that he had, which means I'm in the minority with John on that issue. But having said that, what I'm saying on our side,
when you talk about one of the funding proposals to tax health benefits.
Health benefits, yeah.
I got you. Think by the way, is that a dead issue now, Congressman? Where would that be?
I think it probably is. I think the Senate's concluded it's a dead issue. It never was a particularly viable issue over here. The president, of course, President Obama, during the course of the campaign, said he thought that was not a good idea. I happen to think that it is good tax policy, but I don't think that's going to move forward.
Yeah.
So it probably is dead. But the point is, McCain thought we needed health reform. We can argue, and we're arguing about the ways and means to affect health care reform, but not of the necessity of doing so. So, and we're having that debate now.
But do you really believe that, and I said as a Democrats and Republicans, when they put their faith enough in government and the savings that it might exact, that it will present these huge savings over the years to more than justify the upfront cost? I've not seen that yet in history, and I'm just wondering what crystal ball you're looking into.
Well, let's take Medicare, for example. Now, that's a cost to the government, but Medicare and Social Security together have literally taken, I can't give you the exact millions, but millions of seniors out of poverty, which meant that they weren't on poverty programs, but were in fact sustaining themselves, that their kids weren't put to the responsibility of supporting them and could invest in their kids' college education or maintaining their homes. So I think clearly there's been a very net positive of those two programs. They've been costly. We need to look at them. We need to make sure they're sustainable in the long run, but certainly over the last 30 years for Medicare and some 60, 70 years for Social Security, they have been programs which I think have had a net positive fiscal impact on this country. Now, am I sure on the health care? I'm not absolutely positive. I think we need to be positive of that. We need to make sure that that's the case.
Let me ask you, and finally, we're going to have, I think, Congressman, if this health care package goes through, I think the figure is 39 states that will have a top combined tax rate of over 50%, most of them in the 55, 56% neck of the woods. If you include the health care surtax, the state's taxes, the Medicare tax, the new higher tax rate, and all that.
Yeah.
That's a lot of states with a lot of taxes, yes. Right? And I'm wondering if this is the time to be doing that.
I think the rates need to be below 50. I agree with that proposition. Now, of course, we're talking about people here in terms of that top rate who are making over $1 million net taxable income, or so that we're talking about very high income earners. It's not that they're going to be hurt; it is that they're going to be paying more taxes.
Are you worried you might have? Are you worried though you might just have fewer rich people at this rate?
I don't think, I don't go to town meetings and have people come up and raise their hand and say, I'm worried about having fewer rich people. What they're worried about is having fewer middle-class working people who can make it in this country. That's not to say that we ought to soak the rich.
The reason why I mentioned your colleague in the Senate, Ben Nelson, does worry about the boom it's going to have on rich folks and the fact their ability. In fact, we always go to rich people to pay bills. That's fair, fine, whatever. But he's worried that you keep going to that same well, you run out of water.
Well, I think that's an accurate statement. As a matter of fact, that's why I think we want to keep rates as low as we can. But very frankly, what we've been doing over the last 8 years, Neil, you and I have had this conversation before. I think we've been spending more and paying less. That's not a viable way for us to go forward, and it's, as you know, I think it's an immoral fiscal policy vis-a-vis the next generation, my children, my grandchildren, and my one great-granddaughter. That's not what we ought to be doing. The greatest generation created a great economy as well as defending us from despots. We are going to leave our children with great debt. That's something we ought to be doing. And very frankly, we've had a tremendous spread between the richest Americans and middle-income Americans in the last 2 decades. That's not a healthy way for us to go. So that I'm not sure